Come in.
Hi, I'm Melissa. I'm your student nurse today, and I'll be doing your head-to-toe physical assessment.
Hello.
If you will give me your name and your date of birth.
020282. Justin Claxton.
Okay, good. I'm going to wash my hands right quick, and then we'll get started. Okay, first we're going to start with your head. I'm going to check your scalp, and I'm palpating for any lesions, depressions, or any abnormalities. Okay, good. Now I'm going to check your maxillary sinuses. So let me know if you have any pain or any tenderness there.
No.
Okay, and your frontal sinuses, any pain or any tenderness there?
No.
Okay. Now I'm going to check your facial symmetry, and I'm checking cranial nerve 7, which is your facial nerve. And by doing that, I'm going to have you smile. Okay. Now if you'll puff your cheeks out. Okay, good. Now I'm going to check your cranial nerve 5, the trigeminal nerve, and I'm going to have you close your eyes and let me know when you can feel this.
Yes. Yes. Yes.
Okay.
Yes. Yes.
Okay, good. Now I'm going to check your eyes. Your eyes are symmetric, and I'm also going to check the pupils to make sure they're equal and they react to light. Okay, good. Now I'm going to check the accommodation. If you'll look at the tip of my pen and the wall behind me. Okay, pen, wall, pen. Okay, they accommodate equally. Now we've already checked your cranial nerve 2, the optic nerve on the Snellen chart, and your vision was 20/20. So now we're going to start on your nose. If you'll close off one side of your nostril with your finger and sniff, and then the other side. Okay, there's no blockage. And then if you'll flare your nostrils, okay, they flare symmetric. And now I'm going to look at the mucous membrane. Okay, it's pink and moist. There's no inflammation. There's no deviated septum. Now I'm going to check your mouth, and I'm checking inside for at the mucous membrane and the buccal membrane. It's pink and moist. Your teeth are white and aligned. There's no white spots on your gums. If you'll stick your tongue out, say ah. Okay, I'm checking your cranial nerve 10, your vagus nerve, and there was no deviation in your uvula. And your lips and your tongue are pink and moist. There's no lesions. And your tonsils were not swollen. And also I'm going to check your cranial nerve 12, your hypoglossal nerve, by having you stick your tongue out and move it side to side. Okay, good. Now I'm going to move on to your ears, and I'm going to palpate your auricle. Let me know if you have any pain or tenderness.
No.
Okay, your tragus, is there any pain or any tenderness there?
No.
Okay, now I'm going to check your cranial nerve 8, your acoustic nerve, by having you plug one ear off with your finger. I'm going to whisper in the other ear, and you repeat after me.
5, 6, 7.
Okay, now the other side.
1, 2, 3.
Okay, good. Now I'm going to palpate your trachea. I'm just checking to make sure it's midline with the body. I'm going to palpate the thyroid to make sure if you have any pain or any tenderness.
No.
Okay, I'm going to check your carotid pulse. I'm going to check both sides, but not at the same time. Now I'm going to oscillate for a carotid brewery. Okay, there's no brewery present. If there were, that would indicate stenosis, which is narrowing of the blood vessels. Now I'm going to check your spinal accessory nerve 11. Cranial nerve 11 is your spinal accessory nerve by having you push up with your shoulders. Okay, one more time. Okay, now I'm going to inspect and palpate the skin. I'm checking to make sure the color is consistent with the body. I'm checking for temperature, and I'm checking for any use of your accessory muscle. I'm going to check your respiratory excursion. You'll take a deep breath. Okay, excursion was symmetric. Now I'm going to listen to your lung sounds, and I'm going to percuss your lung sounds. Over the bone, we should hear flatness. Over the lungs, we should hear resonance. Over the liver and over the cardiac, we should hear dullness, and over the stomach, we hear timpani. And now I'm going to inspect and palpate your precardium for any thrills or any heaves. And the heart is located between the 2nd and the 5th intercostal space. And I'm going to osculate your 5 heart valve sounds. To the right of the sternum in the 2nd intercostal space, we have the aorta. We have the pulmonary left of the sternum in the 2nd intercostal space. 3rd intercostal space, we have Erb's point. 4th intercostal space, we have tricuspid. tricuspid and fifth intercostal space, we have mitral. And I'm listening in those areas for any murmurs. And then I'm going to osculate your apical pulse. And I'm listening for any dysrhythmia. Okay, now I'm going to move to your back, your posterior thorax. And I'm just checking for any scoliosis or any kyphosis. Okay, now I'm going to check your respiratory excursion. If you'll take a deep breath. Okay, excursion was symmetric. Now I'm going to osculate your 9 lung sounds. Okay. Okay, now I'm checking your skin. I'm checking for any edema, arrhythmia, or any lesions. I'm checking the turgor for any tinting. I'm checking for temperature. And I'm going to also palpate your radial and your brachial pulses. And they're both bilaterally symmetric. I'm going to check your capillary refill. They blanch within 3 seconds. And now I'm going to check your nails for any clubbing. Okay, there's no clubbing present. Now I'm going to check your range of motion. If you'll just take your right arm and follow me, we're just going to do flexion, extension, and we're going to do abduction and adduction. Okay, good. Now I'm going to check your strength. If you'll put your hands under mine and push up, okay, and then push down. Okay, good. Now I'm going to check the neurologic sensation. If you'll close your eyes, okay, and this is dull and this is sharp, so tell me what you feel.
Dull. Sharp. Dull.
Okay, good. Now I'm going to have you lay down and I'm going to inspect your abdomen. I'm looking, if you'll take a deep breath for me. I'm looking at the contour to make sure it's equal and symmetric, which it is. And I'm going to osculate the 4 abdominal quadrants. And the sounds I'm listening for are hypoactive, hyperactive, audible, or absent. And I'm also going to palpate those 4 quadrants, so let me know if you have any pain or any tenderness.
No.
Okay, now I'm going to check your skin. And again, I'm checking for any edema, arrhythmia, or any lesions. I'm checking the temperature. I'm checking your turgor for any tinting. I'm going to check the neurologic sensation again. So this is dull and this is sharp, so tell me what you feel.
Dull. Sharp. Dull. Sharp.
Okay, good. I'm going to check your capillary refill, and it blanched within 3 seconds. And I'm going to check your range of motion. We're going to do flexion, extension, abduction, and adduction. And I'm also going to palpate your femoral pulse, your popliteal pulse, your posterior tibial pulse, and your dorsalis pedis pulse. And now if you'll sit up and turn towards me, I'm going to check your reflexes. Okay, and this is your patellar, your Achilles. And then if you'll just relax your foot. This is your clonus and your plantar. Okay, now do you perform a monthly breast exam on yourself?
Not at this time.
Okay, you should do it every month. It's very important whether you're male or female. And I'll walk you through the steps of how to do that. If you'll just pick one day out of each month, that's easy for you to remember. And you can do this laying down or you can do it in the shower, whatever's more comfortable. You'll just take one arm and put it behind your head. And then if you'll take your other hand and if you'll start up in your armpit, which is a talus fence, and you work your way into a circular clockwise motion and just work it around till you get to the nipple. Once you get to the nipple, if you'll squeeze the nipple, you're looking for any discharge that comes out of the nipple. And while you're working in the clockwise motion, you're feeling for any lumps or any pain or any tenderness. And if you feel anything abnormal, you need to be sure and contact your physician so you can be seen for a